So a few weeks ago, I had a patient who we considered to be very sick for general anesthesia. This patient had an ischemic cardiomyopathy. His left ventricular ejection fraction was only 15%. He was also on peritoneal dialysis and did not have a very functional lifestyle at baseline. This caused us to sort of think outside the box of how we can provide anesthesia for a patient who needed an inguinal hernia repair. The first thing that came up with this patient in the pre-op area was his potassium was 6.5. So the way we corrected it was with 10 units of IV insulin, as well as 25 grams of D50, which is a whole ampule. We also gave this patient 500 milligrams of calcium chloride to help stabilize the cardiac myocytes. We then let the patient rest for about 20 minutes when we rechecked his lab values and found that his potassium was 4.8. And then in terms of the anesthesia plan for this patient, we decided to do a regional block. So for inguinal hernia repairs, the best block to do is a iliohypogastric or ilioinguinal block, which is basically a tap block, but a little bit lower down in the abdomen. To perform this nerve block, you're going to have your ultrasound probe going axial just above the anterior superior iliac crest. You're going to see your three abdominal muscles, your external oblique, internal oblique, and transverse abdominis. You're going to hit those iliohypogastric and ilioinguinal nerves, which originate from L1 spinal root. The level that you're going to inject your local anesthesia is still in that same plane. So you're going to get underneath the internal oblique and just on top of the transverse abdominis muscle. And you're going to, as you inject, you should watch those planes open up, and that's how you know that your medication is in the right spot. We used 20 mLs of 0.25% bupivacaine, which ended up providing just enough analgesia for this patient and this procedure. This patient ended up doing great, was not in the PACU for too long, and was able to go home that same day. So this is just another example of how we can provide anesthesia for patients who are not functional or healthy enough to undergo general anesthesia.